I'm really grateful to be here with two of my co-chairs of the Nonpartisan Legislative Caucus on Aging. The caucus focuses on policy issues impacting older Mainers, and the findings of the report being presented today should give us and will give us some important data that can help the legislature to find intervention points to improve the economic security of older women in Maine. I've been working a lot on the direct care workforce shortage, and it's interesting to me that earning potential earlier in life impacts economic security later on, and that's one of the things that this report highlights. I'm just really happy to be able to work with my co-chairs on these important issues, and I really appreciate everyone being here and being engaged in the well-being of older Mainers, and encouraged by the interest in the economic well-being of older women. And I'd really like to introduce or to hand it over to one of my co-chairs, Senate Majority Leader, Senator Eloise Vitelli.
Thank you, Representative Fay. Thank you for having me here today. My name is Eloise Vitelli, and I'm honored to serve on the caucus and also to serve representing Saginaw County and the town of Dresden in Senate District 23. I wanted to thank the sponsors of the study for focusing on this critical issue regarding economic disparities, and thanks to Desti for inviting me to share a few remarks as we delve into the details of this report. First, I would say that as a 73-year-old, I qualify as an older woman, and thus I view this report from a very personal perspective. I spent, in addition, aside from 4 to 5 years as a Head Start teacher, I spent the entirety of my career working to improve the economic well-being of women and their families. Over the years, I counseled displaced homemakers on strategies to re-enter the job market, helping them identify their transferable skills, interests, and experience, and guiding them on a career path that hopefully had the potential to offer greater economic security. And for those of you who are not familiar with the term, displaced homemaker was chosen deliberately to describe the experience of women whose primary duties had been in the home, but who had lost their financial support on the death, disability, or divorce from their spouse. One pathway for women that we discovered to take greater control of their financial destiny was self-employment. So I designed courses to teach women how to start their own business. 30 years ago, this was seen as non-traditional and not a very likely path to success for women in starting a business. We also devised programs and advocated for policies to encourage individuals to better manage their resources and plan for their future. Most recently, I'm very proud to say that we've succeeded in creating in statute the Maine Retirement Savings Program to enable more Maine women and men to save for their so-called golden years. All of this is to say that I've been in the trenches working to advance women's economic status for a long time. In reviewing the report we're presenting today, I am struck with the realization that for all of our efforts over the years, decades, the underlying story of women's economic security remains, unfortunately, much the same. Women continue to bear more family responsibilities, often moving in and out of the workforce and spending more time as part-time workers. They are still the majority of caregivers, whether paid or unpaid. Women in female-dominated occupations still earn less today than male-dominated occupations. The gender wage gap persists. Lower lifetime earnings, fewer opportunities to participate in employer-sponsored retirement savings result in lower Social Security payments. Thus, more older women are living in poverty than older men are. As the report itself concludes, quote, gender inequality is a deeply rooted societal issue that negatively impacts the economic security of women throughout the lifespan. Continued investment and policy change in critical areas such as employment, housing, and long-term services and supports is needed to ensure that older women have the resources they need to live comfortably in the communities of their choice. Yes, we've made some progress. When I began my work, women made only 57 cents for every dollar their male counterparts made. And today that gap has shrunk to 83 cents on the dollar. But we have so much more to do. I will continue to do my part, and I am grateful that there's another generation coming along to carry on the fight for women's economic equality. Thanks for having me here today. And it's my pleasure now to introduce our other co-chair, Senator Mary Ann Moore.
Thank you, Senator Vitale. Hello, everyone, and welcome. I've got a couple of strong ones in front of me to follow here. I am Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Sullivan, and Winter Harbor in Hancock County as well. Oh dear, sorry. And I welcome everyone to this exciting data report launch. I'm really excited to see the information. We had a preview of it the other day. And as Senator Vitale said, this is some really, really important information that we really want to share with everyone and take action for it. I think it's very important to make those changes and make those improvements. I currently serve on the Health and Human Services Committee, and as you can imagine, a lot of these issues are very important and near and dear to my heart as we work through legislation that the HHS committee is working through. On the status of women with Senator Vitale, and we understand how important it is that we do make our voice heard and get this information out and make changes. So I welcome everyone here to today's event. And I think at this point, I'm turning it back over to Dusty. Thank you.
I apologize, my internet was not behaving. Thank you very much, Senator Moore and Senator Vitale and Representative Fay. And now I would like to introduce the research team from the Cutler Institute of Health and Social Policy. They really are the folks who made this possible and did such a good job bringing this information together, identifying the themes and trends, and making it possible for us to have this excellent information. So Kim Snow, I'd like to turn it over to you.
Hi, everyone. Thank you so much for having me. It's great to be here. Before I launch into the report, I do want to say a big thank you to the Maine Health Access Foundation for funding this work. We heard from Maine Women's Lobby and Maine Council on Aging in the fall that they would like us to pull together some data to see if we could show how older women in Maine may be at a particular disadvantage when it comes to being able to meet their basic resources needs with the resources that they have. So I just want to give you a little overview of how we produce the report. I'm going to share my screen. Hopefully everybody can see the cover of the report. Essentially, my colleagues, Elizabeth Gattine and Sammy Ellie McKinnon, and I pulled publicly available data, much of it from the US Census Bureau current population surveys and the 2019 5-year American Community Survey, to find out how many women in Maine are living in poverty or close to poverty, how much women earn, what kinds of jobs they do, how many live alone or with others, what maybe their rates of disability are. These are factors that can really impact your ability to meet your needs. And we also pulled the same data for men. So in talking about older women, older depends on who you're talking to. A lot of us are familiar with age 65 as being older because that's when a lot of people become eligible for Medicare. But older Americans Act programs like Meals on Wheels are available to folks who are 60 and older. And because of that, we ended up pulling data on 3 age groups, so 60 to 69, 70 to 79, and 80 years and older. And we felt breaking out that the big group of older adults into those smaller groups really helps to tell a more complete story, because you can imagine that the resources that someone has and their needs of somebody who's 60 might differ from somebody who's 95. You will also see in the report that sometimes we do report on a large group of older adults aged 65 and older, and that's just how the data are available. To get some caveats out of the way, the current population survey and the American Community Survey don't break down gender beyond the binary of women and men. So transgender and non-binary individuals may have participated in the surveys, but we don't have a way to separate out their answers. Likewise, reporting data on race and ethnicity in Maine becomes tricky when we start looking at subpopulations like older adults and older men and older women. The numbers get very small very quickly in the survey data, and reliability becomes an issue. So because of this, we are able to report the racial differences on poverty and wages at the national level, but not at the state level. So just to get oriented, here's some national figures. So you can see women are more likely to live in poverty compared to men across all adult age groups. And especially in this older age group, 12% of women ages 80 and older compared to 8% of men are living in poverty. For women of color experience higher rates of poverty compared to white women across all age groups. And again, especially at this oldest age group, 20% of women of color who are 80 years and older compared to 12% of white women age 80 and older are living in poverty. The median annual income for full-time working women is less than men's across all age groups. And I just want to kind of call attention to this big age range here. This is sort of the prime working years, where the disparity is pretty substantial. And if you just imagine a woman making $10,000 less than a man for 10 years, that will have resulted in that woman having had $100,000 less to meet her needs over that period of time. And it's really a minimum of $100,000 because there is that lost opportunity to earn interest on savings as well as increase wealth through investment vehicles on that $100,000. One of the reasons that women make less than men is that they dominate low-wage occupations. And you can see here, this is the percentage of women as a percentage of the industry workforce. So they make up 87% of healthcare support occupations, 84% of personal care aides. But then you look over on the right-hand side and you see that even though they dominate these occupations, they are still making a fraction of what men make for the same job. So healthcare support occupations, they're making 92 cents on the dollar compared to a man. Personal care aides, it's 88 cents on the dollar compared to a man. Getting into some Maine specific data, again, you can see that a higher percentage of women across all age groups live in poverty, maybe with the exception of this middle group right here where it looks pretty even. But I do want to point out that the poverty rate for women goes up as they age, but it goes down for men. So 12% of women in Maine who are age 80 and older are in poverty compared to 6% of men. Women's full-time working women's weekly earnings, we've heard these statistics, they have consistently been lower than men's over time. So this is data from 2016 through 2020. And we sort of hit our high watermark here in 2018 where we were making 87 cents on the dollar, but then that dipped in 2019 to 78 and change and dipped again in 2020. And I could speculate that COVID-19 may have had something to do with 2020, but I actually don't know what was going on in 2019 to make that drop. Definitely something to maybe dig a little deeper in. When you annualize those weekly earnings, you can really start seeing how the disparities add up. So in 2018, our high watermark, where we were as close to men as we've ever been in terms of earnings, it was still a $6,000 gap on an annual basis. And by 2020, that had doubled to $12,000. I do want to talk a little bit about part-time work. It's not shown on this chart, but more women than men in Maine work part-time. 27% of women compared to 13% of men work part-time. The current population survey collects data on reasons why people either work involuntarily part-time or voluntarily part-time. So an involuntary reason to work part-time is you want to work full-time, but you can't find a full-time job. Maybe there's a slack time in your business cycle, your industry, that there's just not a job for you. But for voluntary reasons, people cite childcare problems or other family personal obligations as reasons to work part-time, meaning they could work full-time if they didn't have these issues. So for a childcare problem, that's defined as not being able to find childcare or not being able to afford childcare. And you can see that women cite that far more often than men. In fact, not enough men cited that as a reason at all to even make a valid estimate in the survey. But over here, 21% of women cite other family or personal obligations, and that can include things like caring for a sick child, caring for another family member, or housework, that caring for the home. Women are far more likely than men to cite that as a reason for working part-time. And of course, part-time work, lower wages, probably lower access to healthcare benefits, less access to retirement programs and pensions. Moving on to some caregiving statistics. This is information from an online survey in Maine conducted for the Maine State Plan on Aging Needs Assessment. It's actually pretty similar to findings from national data from AARP. But in Maine, 85% of family caregivers are women, and that really does have some financial implications, impacts. 38% of respondents said that caregiving was somewhat of a financial strain, and 16% said it was very much a financial strain. So over half of respondents said it was really impacting their financial health. And reasons for that is because workers go in late, they leave early, they take time off to provide that care. 1 in 5 went from working full-time to part-time, or they cut back on hours. Some left the workforce entirely, retired early, had to take leaves of absence. So all of these factors can really impact your financial health. So this, I found that this chart pretty interesting. When we think about women as the majority of caregivers, both family caregivers, as well as making up the majority of those caregiving industries, a personal care attendant, homemaker, things like that. For a state like Maine, we have fewer younger women than older adults, which is different compared to the rest of the country. So our sort of over-reliance on women to provide those caregiving activities and services is problematic. There are just simply not enough women to go around. I think we're seeing that in the direct care workforce issues. So I've talked about wage disparities, low wage work, part-time work, and caregiving, but I do want to focus on women and their ability to meet their needs in their later years. So all of those factors, the wage disparities and low wage work, they can all impact your ability to accrue enough resources to meet your needs. And for people who live alone, it's harder. I mean, in general, by and large, people who share a household with someone else, like a spouse or a partner, in general, are better off resource-wise than people who live alone. And it's not too hard to wrap your head around, because you have 2 people, 2 opportunities to share costs, 2 kind of income streams, perhaps. It just is easier to meet your needs. But there are a lot of older adults who live alone. And in fact, there are twice as many older women compared to men who live alone. So there are about 50,000 women ages 65 and older living alone compared to 23,000 men. And in terms of the resources they have, the median income of men who live alone, older men who live alone, is $27,000 compared to $22,000 for women. So that's $5,000 difference. So is that $22,000, how far is that going to go? How much, what kind of resources do you really need to meet all of your needs? The Maine, or the Elder Index, is a tool that was developed by the Gerontology Institute at UMass Boston. And they provide estimates of the amount of resources that you will need to meet your needs for housing, for transportation, for food and healthcare. And they made this tool to take account of your health status, whether or not you live alone or with someone else, and then also whether or not you own or rent your home. And so we looked at that for Maine. And you can see these are the dollar amounts that the Elder Index indicates or estimates that people will need to meet their needs if they are, say, in poor health, good health, or excellent health, have a mortgage or rent or own their own home free and clear. And you can see these are pretty high dollar amounts. It's just under $35,000 a year if you are in poor health and you have a mortgage to take care of and you're living alone. This line here is the median annual income of women living alone. And you can see it's below all of those bars, except for this one on the end. So somebody in excellent health who own their home free and clear could probably meet their needs based on the definitions in the Elder Index. But really, you know, when we talk about median income, that means half of that group has income that's higher and half has lower. If we have 50,000 older women living alone, that means 25,000 women are not going to be able to meet their needs. They're going to be below this line. So just to get a little more perspective on the number of women who are living alone, older women living alone, it's certainly higher for women compared to men across all these age groups, going from 23% of the youngest age group all the way up to 44% of women who are age 80 and older live alone. And that translates number-wise to over 17,000 women age 80 and older are living alone compared to 6,200 men. So it was 25% of men, that's 6,200 men, that's 25% of that age group. 60% of that age group of men are still living with a spouse when they are 80 and older, compared to just 31% of women living with a spouse. So they live with a spouse at half the rate of men. And I do want to point out this, it's really a pretty low, a small percentage of older adults that actually do live with their family members. I think that there might be sort of an idea that, you know, mom can come live with me or dad can come live with me, but that just doesn't happen. And oftentimes that's not exactly what an older adult wants. Digging a little bit deeper into older adults who live alone and poverty, when you look at those figures, and this is for adults age 60 and older, twice as many women ages 60 and older live alone and have incomes under 100% the federal poverty level. And I haven't talked about the federal poverty level yet, really, but it was just under $13,000 a year for 2021. So that's actually a pretty big gap between the poverty level of $13,000 and that median income level of $22,000. So there are a lot of women who, according to the Elder Index, won't be able to meet their needs. They have income below that $22,000 median income, but they also will not be identified as living in poverty. I want to talk a little bit about disability rates, because whether or not you are able to care for yourself, what disabilities you have will certainly impact your need for services. And a big caveat to using the Elder Index as a method to estimate the amount of income a person would need to meet their needs is that it doesn't include long-term services and supports. It includes healthcare, like Medicare premiums, but not home care or personal care, those very services that would allow a person to continue to live at home in the community of their choice. And you can see here at the youngest age groups, the disability rates are pretty similar between men and women, but with age, women's disability rates really are much higher than men's. In these disabilities such as self-care, cognitive difficulty, independent living, and mobility, the very things that probably indicate a need for assistance from someone else. And it's not shown on this chart, but research indicates that 55% of women will use some form of paid long-term services and supports over their lifetime, compared to 38% of men. So if you need long-term services and supports, how much is that going to cost? I mean, that has to be added into the amount of resources that you'll need. And this information, it's the estimates of private pay long-term services and supports in Maine. This is information from the Genworth Cost of Care report. It's an annual survey. And you can see here, Homemaker Health Aid is almost 3 times the cost of the annual median income of older women living alone in Maine. Even if they needed 22 hours a week of that type of care instead of 44, it would still outstrip the resources of somebody at that median level of income. And with that, I'm going to stop there. I'm going to ask Elizabeth Gatteen if she has some thoughts she'd like to share as well.
Hi, Kim. Thank you. That was a very thorough, I think, presentation on the report, and there's more data in the report, as well as the data that Kim presented. I just want to say 2 words because I know we're short of time and we have some excellent people coming after us. But I just wanted to really point out, I think that this report highlights the importance of disaggregating data wherever you can. And I think here it shows the cumulative impacts of economic disparities over time, that older women have lower median income, a greater number of older women living in poverty, a much greater number of older women living alone. And I think one of the key takeaways is how many older women who are not at or near the federal poverty
but you don't have it. So if you got a bill, it doesn't matter.
Are still unable to meet their essential needs for housing, food, healthcare, and transportation. And as Kim mentioned, when you add long-term services and supports to that, then it is again even more so.
Take the wrong dental. That's all, honey. Don't worry about it.
Just taking that last example
giving them the right one.
Services
Call
and
them
supports,
later.
I think that this
After
report
lunch.
really focuses on the integral role that women play in the long-term service and support system. Not only do women represent the vast majority of paid and unpaid caregivers, women are also more likely, as Kim pointed out, to be the recipients of those services. So this directly impacts the economic security of women and has implications to the workforce, not just the direct care workforce, which I think there was some pretty startling data in the report for that, but workforce generally, and also has implications for some of the programs and services in terms of eligibility, outreach, and service delivery, so that we can ensure that as older women, we have access to the resources that we need and can age comfortably in the communities of our choice. So at this point, I know just because of time, I'm going to turn it back over to Desti, and we can hear from others about this issue with the more lived-in experience. Thank you.
Actually, I think I'm going to take over now. So thank you all. I'm Jess Maurer. I'm the Executive Director of the Maine Council on Aging, and thank you for joining us. And thanks so much to Kim and everyone at the Cutler Institute for your incredible work on this seminal report. We are definitely going to be unpacking the data and the repercussions from it for some time. I also want to thank, as Kim did, the Maine Health Access Foundation for funding this report. They're one of the few foundations really in the nation prioritizing the health of older people in their funding, and we are grateful for their commitment to these issues. So it's now my great pleasure to introduce our next speaker, Fran Seeley, who has been a foster grandparent with the Opportunity Alliance for nearly 20 years. The Maine Council on Aging honored Fran with our 2019 willing to offer a powerful and personal voice to the challenges of living a purposeful life on a fixed income. I was thrilled that she was willing to read this report and to share her thoughts with you about these findings. So Fran, take it away.
Hi, everybody. As Jess said, I'm Fran Seeley, and I'm honored to be here today. And, you know, I read the report. I can't say that I digested all of the numbers because there were lots of them in there, but I certainly identified with the findings. I am just a couple of months shy of 81, so I'm in your third section of the report. And You know, I'm qualified as a teacher and administrator in education. The first 10 years of my career, I was in a convent, so I got diddly squat. I mean, I guess I got in kind because I had a place to live, all my needs were taken care of. However, the convent at that time was exempt from paying into Social Security. So those were like 10 non-earning years. And then I continued, after I left the convent, I continued working in parochial schools. And the highest salary I ever earned, even with a master's and credentials in teaching and administration, was $22,000 a year. So I knew that my Social Security benefits would not be very high. And then my husband, I got married, obviously after I left the convent, which, yeah, maybe it could have happened before, but it didn't. But anyway, he was a self-employed jeweler. So neither one of us ever had a pension or anything like that. And we were pretty circumspect. Every month we would pay into, we each had an IRA account and we saved. We didn't scrimp and, you know, count our pennies, but we knew we needed to set aside money to supplement our Social Security. Anyway, the result, and it's been mentioned by other speakers, the result of low earnings means that now I get the grand total of $755 per month in Social Security.
Good.
Can't live on that. And I'm very fortunate again, because neither Jim nor I were the kind who would buy anything unless we could pay for it. We always felt if you can't pay for it, you probably don't need it. And we saved in order to get our first house. And we made a plan that it would be paid for in 5 years. And we did it. Now, obviously, it's not the same price as houses right now. So I don't have a mortgage on my house. But to supplement my 755 big deposit into my account, I have taken out a reverse mortgage on my home. And I get $400 from that. I probably could increase it, but I want to have it stretch. You know, I might live another 10 years, 20 years, who knows. And then I also have my IRA disbursement, which is around $350. So I'm well below what the federal poverty level is in terms of my income. And my savings, I draw on that for paying for property taxes. And as I was mentioning to Jess in a phone call, I always said, well, if I ever had to have a new roof, I don't know what would happen. Well, the year of the pandemic, I needed a roof and I needed work in my basement. I called it my Oreo cookie year. The filling in the middle was okay, but new roof and basement work came to around, I think it was $11,000 out of my savings. And before 2015, I think it was, my Social Security benefits made me eligible for the Medicare buy-in program. And right now that runs, I think, around $150 a month. I was also eligible for Maine Care. Now, I didn't even have to apply for that. I just fell into the category where I was eligible. And then in 2015, in balancing the budget, not at the legislative level, but it was for the DHS, a bunch of us were struck off that because an assets limit was used to determine eligibility. So those assets that I circumspectly provided for to supplement my income now became a liability. We're kind of punished if we have saved, punished if we put into an IRA, or even a life insurance policy. You're punished for having that because it's a liquid asset. And all of those, if they amount to anything more than 50,000, cuts you off. Now, if anybody only has 50,000 as a backup when your income is around $1,500 a month, you know, I think we're in bad shape. And I'm not saying that I'm living in poverty. I consider myself to be living in abundance because I've learned to appreciate what I have and distinguish between my needs and my wants. But it does mean, you know, I cut my cloth according to its measure. I don't spend frivolously. It doesn't mean that, you know, I watch every dollar. If I want to go out to dinner with somebody, well, at least before the pandemic, you know, that was an okay thing to do. But I still, I look at my my financial assets, and I look at some of the things like, you know, if I needed home health care or anything like that, I could never, ever afford it. And I just am so grateful that I'm in excellent health. I don't owe anything. But I also think, you know, living alone, it costs as much for me to maintain my home and my car as it would if two of us were using it. And two of us were contributing to the maintenance cost of it. So women living alone definitely are at a disadvantage financially. The other thing that I was going to say too is that, you know, having savings, I was always brought up to believe that that was essential. You know, you don't always spend everything you have. You always put something aside. I mean, now I don't save. I just take out of those savings. And it's not a bottomless pit and a bottomless well. And Jess helped get a bill going through the legislature that would get rid of the assets test. And we really got great steam going. And then it got tabled when it finally got to the Appropriations Committee. And that was right before the pandemic. So I don't know if it's there gathering dust or if it's been round filed or what, but I think anything that the report can do to get legislators, the legislators were immensely sympathetic to the plight of older people, older women, and their financial hardships. And I think they were very much in favor of that bill. And then circumstances changed. So I do hope that looking at these actual numbers that Elizabeth and Kim have culled together, that legislators will look and say, this is reality. And what are we going to do about it? Because older people shouldn't have to, you know, watch every single dime that they spend. We should be able to live gracefully. And, you know, we're all getting there. Some of us have arrived, some of us are still on the journey, but we'll all get there. And I'm so grateful to the research that has been done so thoroughly. And I'm hopeful that it will take effect. And, you know, especially for women who are living in poverty, that they will have some of those worries and anxieties relieved from them. So again, thank you, Jess, for inviting me and everybody for being here.
Thank you, Fran, so very much for sharing your experience with us. It's the most important voice that we can have here. And I will tell you that what Elizabeth said just before you began speaking about needing to disaggregate information, this is your story underscores that. For both the wait list I'm going to testify on this afternoon, which has predominantly women waiting for services. I imagine that if we went back and looked at the number of people who lost their benefits because of the asset test, we would find that it was more women than men, just simply on the utilization data that we already have in that way. So we're going to start asking the legislature to look through a lens, not just of racial equity, but also gender equity and age equity as we begin to make decisions about whether we fund benefits for older people or not. So I'm just gonna.
Jess?
Yes.
Jess, it's Elizabeth. Thank you, Fran, so much. I love always hearing from you. I just wanted to say very briefly to Fran's point that in the appendix of this report, we did put eligibility for many of the programs, including the ones that Fran are talking about, because I think that does help link some of the data in the upfront to where some of the services and benefits and programs have set things. So that is part of the appendix to the report as well. I just wanted to point that out for people when they see it.
Thanks so much, Elizabeth. That's great. So I'm just going to say a few more words and then pass things back to Dusty. I just want to say that this report really shows that the economic disparities women face over a lifetime add up to poverty or near poverty for too many in later life. And while we need to ensure, as Senator Vitelli said, that generations of women don't age into poverty, that we also redesign our supports and services to equitably address historic gender-based injustices that have led to tens of thousands of older women not having enough resources to meet their basic needs. So in addition to this, to that, we take from this report some suggestions. One is to improve statewide systems to keep women working, like paid family and medical leave, quality affordable dependent care, create solutions for unpaid family caregivers, such as social security credits, respite, and even pay for their work. Fairly value and compensate our professional caregivers, including direct support workers and child care providers. Address age and gender discrimination in wages and workplaces. To be clear, many women, older women, must keep working because of the data that is provided in this report, but they are passed over and or pushed into lower paying jobs as they age. Finally, we need to reform our long-term supports and services system through the gender equity lens I was just talking about, addressing gaps in services, expanding program eligibility, and potentially using the Elder Security Index to create a new eligibility standard. So thank you so much for joining us here today. And I'm going to turn things back to Dusty for any closing remarks and then for some question and answer.
Thank you so much, Jess, and thank you, Fran, and the team at Cutler. And I have other thanks to offer as well. I really, again, want to thank the Maine Health Access Foundation that offered the grant to support this effort, without whom we could not have done it. As well, the team at Cutler, especially Kimberly Snow, Elizabeth Gattine, Sammy Ellie McKinnon, and Rebecca Werwerg, who did such a beautiful job designing this in a way that helps us really understand the data. I also want to thank the members of the advisory group who helped support the process of this, including staff from AARP Maine, Aroostook County Area Agency on Aging, the Maine DHHS Office of Aging and Disability Services, Waldo County CAP, Legal Services for the Elderly, the Permanent Commission on the Status of Women, and Maine Equal Justice. We really know, after hearing all of this today and our own lived experiences, that taken together, wage disparities, undervalued labor, and unpaid care labor mean that women enter their older years less financially secure than men and are facing impossible choices. We also know that complicated problems have complicated solutions. We want to assure you that the advisory group plans to meet again in March to review this data, identify the trends, and move forward those systems-wide solutions that Jess mentioned earlier. We have to continue to support women across the lifespan if we don't want women aging into poverty in the way that this report details. So we're looking forward to working with the legislature and our many partners here today across the state in building these better systems for equity for all of our people. And I thank you to all of you who are able to be here today on the live stream and in the Zoom room. We're going to close this out now, but if you do have questions, you're welcome to stay on the line, and a few of us will be here after to answer them. Thank you all so much for your time.